If you had a splitting headache 10,000 years ago, living in a cave with nothing but stone tools, the cure might have involved someone drilling an actual hole into your skull while you were fully awake. And here's the part that should genuinely disturb you. It often worked. So how did actual cavemen handle injury, illness, and pain long before anything resembling a hospital existed?
The answer is stranger and weirdly more advanced than you'd expect. Let's start with the procedure that sounds like a horror movie: trepanation. This is exactly what it sounds like: cutting or scraping a hole directly into someone's skull with a sharpened stone. It's the oldest known operation for which evidence exists, and it dates back to Proto-Neolithic times, tens of thousands of years ago. At one burial site in France, dated to 6,500 BCE, out of 120 prehistoric skulls found, 40 of them had trepanation holes. A Swedish doctor and historian even pointed to Soviet excavations along the Dnieper River, suggesting trepanation was happening as far back as roughly 12,000 BCE, which is deep into true caveman territory, long before farming, writing, or cities existed anywhere. Here's the truly wild part. This wasn't a death sentence. There's significant evidence of bone healing in these prehistoric skulls, suggesting many patients actually survived the operation. And in some studies, the survival rate topped 50%. Half the people who had holes cut into their heads with stone tools and zero anesthesia lived to tell the story, probably while nursing the worst headache of their entire life. Why would anyone even attempt this? Historians believe early humans used it to treat headaches, seizures, and mental disorders, often based on the belief that it released evil spirits believed to be causing the problem. That sounds like pure superstition, until you realize modern doctors still occasionally perform an almost identical procedure today, just with sterile tools and real anesthesia. Today, it's called burr holes, and it's used in extreme cases to relieve bleeding inside the skull after a head injury. The core idea genuinely wasn't wrong. It was just wrapped in myth instead of science. Skull surgery wasn't the only trick cavemen figured out either. They also handled something even more brutal: full limb amputation. The oldest known surgical amputation on record happened in Borneo about 31,000 years ago, removing part of someone's lower leg. The person survived the operation and lived another 6 to 9 years afterward. Someone, using Stone Age tools in the middle of a rainforest, performed a successful limb amputation, and the patient walked away with years of life still ahead of them. Now, fast forward tens of thousands of years, past farming, past writing, straight into the ancient civilizations of Egypt, Greece, and Rome, and you can actually watch this same instinct evolve from raw survival guesswork into something resembling real medical science. Egypt turns out to have had shockingly advanced knowledge for its era. The Edwin Smith Papyrus, the world's oldest surviving surgical text, was written around the 17th century BCE, based on material possibly 1,000 years older. This wasn't magic and prayer anymore. It's an actual textbook on trauma surgery, describing anatomical observation, diagnosis, treatment, and prognosis for numerous types of injuries in real detail. Excavated mummies back this up. Evidence shows Egyptian surgeons performed excision of tumors, drained pus-filled abscesses, practiced dentistry, and carried out amputations, alongside magic and spiritual rituals layered on top for good measure. And they weren't just surviving surgery, they were rebuilding afterward. Bodies of amputees from the Old and Middle Kingdoms have been found showing genuine signs of healing, and archaeologists have even found prosthetic limbs that show real signs of wear from actual use. Ancient Egyptians were building functional prosthetics thousands of years before you'd expect. Not every ancient remedy holds up quite as well, though. Some of it is frankly disturbing by modern standards. Urine drinking was a genuinely popular medical practice in ancient Egypt, Greece, and Rome, believed to have therapeutic properties for treating kidney and liver problems. And then there's bloodletting, maybe the most infamous ancient treatment of all. It's one of the oldest medical practices on record, used by the Mesopotamians, Egyptians, Greeks, Mayans, and Aztecs alike. The theory behind it, from a Greek physician named Erasistratus, was that many diseases came from an overabundance, or plethora, of blood in the body, so the fix was simply to drain some out. This practice didn't stay in the ancient world either. It stuck around for literally thousands of years afterward. Rome and Greece eventually pushed surgery further, treating it almost like an actual profession, rather than a spiritual ritual. Hippocratic medical texts name a surprisingly large number of specialized instruments: bone drills, probes, needles, tooth forceps, bone elevators, and even devices for crushing skull fragments. Their surgical skill was genuinely impressive at times. One archaeologist examined an ancient Greek thigh bone and called the surgical repair remarkable, noting that someone had used real force to pull the broken bone back into place and hold it there for weeks against the immense pressure of the surrounding muscles. But it wasn't always a fair fight against injury. Broken bones were sometimes simply not set at all, leaving victims disfigured for the rest of their lives. A stark reminder that skill and outcome depended enormously on which doctor you happened to get, and pure luck. Where did Roman and Greek doctors even sharpen their skill in the first place? A grim but honest answer: war. Wounded soldiers were one of the best ways for a doctor to understand the human body's inner workings, and there was less risk of the soldier causing problems if something went wrong compared to a private, paying patient. Battlefields effectively functioned as the medical schools of the ancient world. So step back and look at the full arc. It starts with a caveman cracking open a skull with a sharpened rock, and somehow succeeding more often than not. And it ends with Egyptian surgeons writing detailed textbooks and fitting patients with working prosthetic limbs. Somewhere in between sits pure guesswork, draining blood, drinking urine, hoping for the best. It's a strange mix of genuine genius and total superstition, often happening to the very same patient on the very same day. The truth is, ancient medicine, cave dwellers included, wasn't primitive nonsense. It was humanity's first real attempt at reverse engineering the human body with almost none of the tools we take for granted today. Some of it was pure superstition. Some of it we're still quietly using in hospitals right now. If this made you look at a headache a little differently, hit that like button and subscribe for more of these. I'll see you in the next one.